Okay, as people are jumping in, I think we can go ahead and get started with the introductions. So I'll go one by one, if you guys don't mind. And I'll start off with Sertaç. Sertaç Güzel received his Bachelor of Science in Industrial Engineering from Bilkent University in Turkey. He started at J&J in 2005 and moved to Global HQ organization in 2012. He then left J&J to join Verb Surgical, a joint venture between J&J and Google in 2017, and then rejoined the company upon J&J's acquisition of its remaining shares in December 2019. Previously, he held various leadership roles in sales, marketing, health economics, commercial excellence, and new business development for Ethicon in USA, Germany, and Turkey. Sertaç is currently responsible for marketing and partnership strategy for Johnson & Johnson's digital solutions platform. So welcome, Sertaç. Going to Hakan. Hakan will be representing the tourism industry today. Hakan Özakbaş received his engineering undergrad degree and an MBA from University of Central Florida. He worked as a director of operations for the O Property Collection, a boutique luxury hotel development, where he managed the development of luxury hotels in the Caribbean. His Turks and Caicos projects Hallmark, Mandarin Hotel, and Residences received global attention. He then joined leading hotels of the world as the director of analytics and finance reporting, where he was focused on providing business intelligence. Leading Hotels of the World is the largest luxury hotel collection with close to 400 hotels and resorts over 80 countries. So it's going to be interesting to receive his feedback on the hospitality industry. Currently at LHW, Hakan oversees the revenue and quality performance of 90 hotels in the Americas region. So welcome, Hakan. Aydın Sün is a former developer who worked as a tech journalist for Computer Work and Information Week's Turkey editions, and as a business development specialist for Super Online and TUSIAD. In Silicon Valley, he worked as a public relations consultant for tech companies like Google, Cisco, and Panasonic. He later founded Faselis, a media database and press release distribution platform. Faselis is currently the market leader in Turkey and started to operate in the US after Netherlands and South Africa. And Aydın currently serves as the CEO of Faselis. So nice to have you here, Aydın.
Thanks.
Now we have more people tinkered in. I want to start off with the healthcare.
I think we lost them for a second.
You lost Buğrahan, right?
Yeah. Buğrahan? Yes, he's back, I think.
Oh, did I get cut off?
We lost you for a few seconds.
Yeah.
My bad. Yeah, my computer is warning me as well. Okay. So Sertaç, I'm gonna direct my first question at you.
Yeah.
Healthcare has been on the news more than ever before. And as we approach new highs in terms of cases, what measures do you observe that the healthcare industry is taking to operate effectively?
Yeah. So first of all, Buğrahan, thanks for pulling this together. Really appreciate the organization's efforts, I think, to pull us together for this conversation. I mean, I think, in general, first, before I answer that question, you have to appreciate that healthcare industry has a unique sense of responsibility when it comes to participating in solution with this crisis. Just think about it this way: in addition to having to absorb the social and economic consequences of the crisis, it also, while doing so in the process, has to find a solution, has to participate in the solution. Meaning, we have to develop the safe and effective solutions for diagnostics, so people get tested, it's accessible, affordable, at point of care or at home. They get the treatment that are antivirals, and also there is immunization for the virus. So you have to find a way to sustain the operations, but on top of it, innovate for this new novel problem while absorbing the effects of the crisis. When I think about this question, I think there are three areas where we have seen the healthcare industry where they really, I think, strongly adapted to the new norm and found solutions to take measures unique to the circumstances we are facing. The first one of those is really supply chain. I think it's about ensuring access to the critical medical devices and also the medication in order to avoid any disruption to healthcare services in general. Because COVID might be our #1 problem right now, but it's not our only healthcare problem. How do we maintain continuity in healthcare is a major issue. So healthcare industry had to really, I think, change the working protocols, safety protocols, be able to maintain operations. Anything from sourcing to manufacturing to distribution got affected. We had to find new ways to solve for the same problem and maintain these operations. That's #1. #2, I think we have also seen the industry adopt the operational model, meaning the way we engage with our customers, the way we engage with our partners, and the way we create value for them has changed drastically. We are currently very much focused on finding ways to help healthcare providers resume their operations. There has been significant disruption to diagnosis and treatment of other diseases. As I mentioned earlier, cancer doesn't stop, obesity doesn't stop, circulatory disorders doesn't stop. They continue being a problem for many patients across the world. And these patients do not have access to healthcare because COVID is dominating the headlines and it's disrupting healthcare services in general. So every industry player, and I can speak, from what I have been exposed to on Johnson & Johnson's side, is trying to be a part of the solution, finding ways to first address the shortcomings in the healthcare delivery system. This could be anything from helping with the equipments that are in shortage, like personal protective equipments, ventilation devices. J&J has been one of the agents here trying to help, even if these are product categories that they are not playing in actively. But in addition to that, also find ways to foster collaboration, information exchange on this new novel problem, so the frontline healthcare workers know how to deal with this situation. We have focused on patient awareness programs to raise awareness and to kind of encourage patients to go back to their healthcare providers, get the treatment they need on other conditions they might be facing. And also we changed, as I said earlier, we changed the way we engage with our customers, trying to be virtually more available, more effective, and being more receptive to how they actually would like to work. So there are changes on the operational model side of things. You will hear from a lot of healthcare companies picking up their game when it comes to digital solutions and virtual engagements. So there's a trend of digitization and moving from analog to digital in our services in general as a and the third, I think, set of measures, maybe most importantly, are in the innovation field. I think here we have seen significant agility from industry in developing, testing, and launching new solutions that will help the rapid, reliable diagnostics, the treatment of the conditions associated with COVID, and essentially all the surrounding, pharma solutions, medical solutions that are required to treat COVID or treat other conditions that still exist. It was very impressive to see, like we were able to understand the entire genetic makeup of the virus in a few days. Testing devices, antivirals got into the market immediately. We have seen, I think, product development and approval life cycles shrinking from years to several months. And this was tremendous to watch as someone in the industry. I'm not saying it's only thanks to the industry. This was definitely a system-wide collaboration. We have seen policymakers, healthcare administrators, regulatory bodies, all those emergency use authorizations, everybody being hands on deck, helping with this. Some countries did it better, some countries didn't do it as well. But I think in general, we have seen significant agility in how we innovate and how we find solutions for the crisis, which was critical. So I would summarize the key measures under these 3 pillars.
Thanks a lot, Sertaç, for laying out the field for healthcare, how they're operating effectively under these circumstances. Before I switch to Hakan, I just want to say to our attendees that you can post your questions either in the chat section or the Q&A section, and we'll get to them at the last 10 to 15 minutes. So switching gears to hospitality, Hakan, hospitality has been dramatically affected by the pandemic, with most of the world sheltering in place. And to better understand the scale, how has damage been to the different segments of the industry, such as group travel, corporate travel, and leisure travel? And do you have any timeline predictions for the recovery? You're on mute.
All right, thank you, Buğrahan, and thank you again for putting this all together. It's such a great opportunity, and I'm very honored and humbled to be part of this organization. As everybody knows, hospitality industry has been one of the most impacted as the travel stopped. When we started the year in January, February, we thought we are going to break all kinds of records in terms of revenue and occupancy in hotel rooms. It was such a thriller start to 2020 until mid-March. And of course, as everybody went down into a decline in business, so did the hospitality industry, specific to hospitality industry. I mean, we've been attending a lot of webinars and conferences throughout the year. As we stand today, most of the hotel occupancy is down 80 to 90%. And this is valid for all big brands like Four Seasons and Ritz-Carlton and Mandarin and leading hotels, and anything from luxury segment to mid-scale to economy. People just stopped traveling, and the hotels are empty. And the problem is the borders are closed too. Now I'm overseeing Asia Pacific as well. And I talked to a lot of hotels in Asia Pacific, and the borders are closed for these countries like Thailand and Fiji and Japan and China. So even if you want to travel, you're not going to be able to travel to these countries. And so that leaves us with only domestic business. And the domestic business, you know, I'm going to give you an example for all those people who are from Turkey. You would know Dimaris as one of the most prominent hotels in the Aegean coast of Turkey. They're an exception, for example. They did probably it was their best year this year because people couldn't travel outside of Turkey. Those who would travel to Italy and France and other countries or to other destinations in Asia or US, they couldn't. So they ended up traveling within Turkey. And hotels like Dimaris and Mandarin Oriental and a lot of the summer spots, I would call it, these hotels did so well. But then you have the city hotels like New York and London and Tokyo and Shanghai. These hotels that are in these destinations didn't do so well. Now you have to look at it from different perspective. I think I would first look at it from what segment is the hotel part of? Is it a luxury hotel or a mid-scale or economy? I think luxury hotels suffered the most, and leading hotels of the world, the organization that I'm part of, it was founded in 1928, and probably this is the worst year of the company in terms of revenue, generated revenue. However, we are trying to find ways to reinvent our business model, reinvent the business, and go through this. I think we are standing very tall and standing strong despite all the different curveballs that we have this year. But what I was saying is, like, some hotels are doing so well and some hotels are not doing so well. The luxury segment is not doing so well, but within the luxury segment, there are hotels like Dimaris and Mandarin Oriental and Bodrum. I think they broke their revenue records this year compared to the previous years. Then when you look at it from different perspectives, like the leisure travel and the corporate travel and the group travel, you know, the group travel will be like weddings, for example. You don't see a lot of weddings. People are postponing their weddings due to coronavirus. And the corporate travel, it's almost non-existing at this point. Companies are not letting not letting their employees travel. Even we are a travel organization. We're not even traveling. Our office is closed. I'm normally based in New York City. I've been there over a decade now, and but now I am in my homeland in Turkey and working from here because the office is closed until January. So there's no corporate travel. The leisure travel is the only travel, and the hotels that I was talking about to you on the Aegean coast or in Capri in Italy or south of France in France or in Mykonos or Santorini in Greece, you know, they are filled with domestic business, with the leisure travelers, because we all realize that we can do work from home, and we can postpone weddings, and we can postpone meetings, in-person meetings, but the leisure travel is comprised of 5 senses. You have to smell, you have to see, you have to taste, you have to feel. This is only, so you cannot travel, you cannot vacation from home. That's why I think leisure travel is going to come back much sooner than corporate travel. It's already here for some certain hotels, like I told you. But the corporate travel and group travel, we're expecting 2022, 2023 for it to come back to normal levels of 2019. But I think the normal is whatever you define it, right? The corporate travel is going to change. The group travel is going to change. A lot of the hotels are going to reinvent their business models, which I'm going to be talking about hopefully in the next few questions.
Thank you very much, Hakan. It's very interesting to hear that the domestic aspect of things has been actually recovering when people couldn't travel outside. So switching gears to media, which is something that's less talked about, but also equally as affected by the pandemic. You've been involved in the media and press release industry for more than a decade. What has been the biggest struggle for your clients during this pandemic? What has been your observations in the media?
Thank you, Buğrahan. First of all, thank you to TUSIAD to invite me to this event, and also I want to celebrate all of the participants Republic Day. That's tomorrow in Turkey. In media industry and in public relations industry, it's very connected to each other. In some time, media industry was reshaping. Companies or big media companies were getting smaller, and the online media business was growing, and the conversational media was getting smaller in some time. But with COVID-19, it was a big strike to media industry, because when there's an economic problem in any country, the first thing that companies do is just stopping the advertising or cutting the budgets in marketing. So especially in the online media, you are living with the advertisement income, nothing else. So the big companies, the big media companies, lose most of their revenue. So because of this, thousands of journalists lose their jobs, and it's not a near future. It will not be in the near future that they will all have their jobs back. So the media industry is reshaping. What does the media professionals do when they lose their job? Probably they mostly create new online publications. So the scope will be growing. We will see much more online publications, online media, but I'm not sure the quality will be high, because it's now especially the online publications work with very, very small teams because of the incomes, and that means the quality cannot be high as a big media company. And for the public relations industry, it's just the same. I have some numbers, like in US market, 1/3 of the PR agencies lose their revenue, 20% of their revenues, and another 25% lose 10 to 20% of their revenues. These are really high losses for the PR agencies. So also the employment in the employment rates are getting down. Lots of PR professionals are also losing their jobs, and in this area, if a PR professional lose a job and cannot find anything else in another company, they usually start to do freelance PR. So the number of the freelance PR professionals are getting higher and higher each day, and we can see this growing for our business, because we are working with not only the PR agencies but also freelancers and big corporates. And because of these economic problems, companies stop working with PR agencies and they start to do public relations or media relations with in-house teams or with a marketing person. So it will be a hard time for the next 2 or 3 years. It will be a very hard time for both media industry and public relations industry.
Thank you very much, Aydın. It's actually pretty interesting to hear that the online field is getting much more activity in the coming days because of people losing their jobs. Hopefully, it'll be a way for recovery for most of those unemployed friends we have. Now, switching back to healthcare, Sertaç, let's talk about a little bit about your personal experience. In December 2019, Johnson & Johnson acquired Verb Surgical, the digital surgery platform company where you previously worked at. And as the Director of Marketing and Consumer Partnerships at J&J, how do you see the robotics and digital solutions playing a role in the new reality? And have you made any significant pivots to the marketing and partnership efforts?
Yeah, so I mean, how do I see the impact, the evolving impact, Buğrahan? I think it's huge. People really liken it to the space race of our generation when we talk about how digital technologies are getting more and more adopted in healthcare. It might sound like common sense that, you know, in healthcare where human life is in question, you would assume actually the latest technologies are being adopted and utilized in service of providing the best treatment possible. But unfortunately, that's not the case. Healthcare industry historically has been behind the curve, behind industries like obviously military, aerospace, and consumer tech applications when it comes to adopting these latest digital solutions. And what we are seeing right now is a step change in that sense. I think we started an irreversible trend, and digital solutions are going to be in the fiber of everything that healthcare providers do. So I'm very pleased to see that. I think that's one of the silver linings of this crisis. Unfortunately, hopefully, unfortunately, I mean, you wish it didn't come to this, right? To have this change, but you know, the regulations were the way they were for really good reasons, because again, human and patient safety is in question, and you know, data privacy and data security were significant barriers when adopting these digital solutions. But today, I think we see tremendous receptivity and overcome of these barriers. To your other question, we as a company, did we pivot? Did we change anything? I don't think we pivoted, because this was exactly aligned to our vision. I would say what changed is we put on the gas pedal a bit more to be able to provide the services and solutions that the healthcare providers are in need of, especially at these times. They are struggling with, as I mentioned earlier, resuming the broader healthcare operations. They are in partnerships to provide, you know, online learning resources to them so that they can exchange information. We have patient awareness programs. We are deploying digital solutions which were only available in the US. We are globalizing them so that education and learning can continue, et cetera, et cetera. So we are taking a lot of measures to make those digital solutions available to the hospital systems around the world, so they can also operate effectively in this environment.
Thank you very much, Sertaç. It's good to hear that the healthcare industry is having a good time in terms of adapting to the new world and, you know, going behind making up for the behind the curve situation, which was in the
Right.
past.
Agree.
So moving back to the hospitality, Hakan, I'd like to ask you, being a director of business performance at leading hotels of the world, what business metrics will you be observing to determine the success in recovery as the hospitality industry adapts itself to the new normal? And did COVID require you to invent any new metrics for assessment, for a better assessment?
Yeah, no, it's a great question. The key metric for hospitality industry has been always occupancy and the ADR, which stands for average daily rate. And they feed into this metric called RevPAR, revenue per available room. So if you're a hotel owner or a hotel general manager, the metric that you always look at are these three: occupancy, daily rates, and revenue per available room at the end of the day. How much revenue are you getting for your room per room at your property? These are they have always been the metrics that we've been looking at, and of course they will always be, because this is at the end of the day what determines the success of a hotel. But now we are closely monitoring the digital searches, for example. We are trying to observe if people are doing searches for airlines or flights or hotels, things that we were not looking at before, because all the hotels and all the companies, all the brands are fighting right now for the same piece of business, right? The pie is not bigger. The pie is actually much smaller, and people are looking for a bigger slice from that smaller pie. New metric that has emerged after COVID-19 is the cleanliness, the hygiene standards. As we're working with the travel partners, like the travel agencies, corporate travel managers, and other group houses that book rooms for big groups, number one question that they ask is if the hotel is certified for hygiene. There are a lot of different certifications that came out during this pandemic, and so the certification is very, very important. And also there's a lot of different standards that are now being built into the hotel operations, and as hotel executives we'll be looking at these cleanliness standards and monitor those. Now in terms of creative ideas, during the pandemic there have been so many different creative ideas, and I want to give you a couple examples. Our hotel in Malibu, for example, Malibu Beach Inn, they have converted, it's a waterfront hotel in Malibu. It's a beautiful property. Obviously after the pandemic they had very little occupancy in their rooms, so what they did is they converted some of their rooms into office space. So and they sold it as a hotel room, but people who no longer wanted to be home, for local residents, people who are in LA or Malibu, maybe they wanted a little escape from their family. The office building is close and they wanted to escape. So they went to this beautiful waterfront location. They had the view and they sold as a hotel room. And they had significant business from that office space business model. And it was in some cases families who came to the hotel, and maybe the wife and the kid were at the beach and hanging out, and they generated revenue from food and beverage. Or it was vice versa. Maybe the husband and the kids were at the beach and the wife was working. So all these different kind of business models emerged, and people were thinking creatively to see, okay, I have real estate, I have space, and the traditional approach is, okay, I'm going to sell this as a hotel room. But now with the new approach, the new creative ideas, I'm going to, utilize, how can I utilize this space? People start thinking creatively outside of the box. Yeah, these are some of the things that I would like to highlight in terms of metrics and new business models. And digital, obviously, a lot of people, a lot of businesses went digital, and a lot of the hotels and the brands are spending more on digital marketing to really get the attention of the consumers, especially through social media. because everybody's spending time on social media, more time on social media. The ads and the sponsored ads for the hotels have dramatically increased.
Thanks a lot, Hakan. It's interesting to hear the pivot that Waterfront Hotel done to convert them their hotel rooms into spaces. I think we'll see more of that coming in the next months for sure. Now, moving on to media again, Aydın, as the CEO of Faselis, you've been driving the international expansion of the company. And due to the pandemic, what do you think the approach has been to globalization and access to international markets will be?
It was always a challenge to build the international business, but in the pandemic days, the sky is much more foggy. So we were planning expansion to especially major European countries, and we are still working on this expansion, but we just slow down a little bit, and we want to see what will happen, and then we will start to work harder for these markets, because as I told earlier, if the economy is bad, then that means the media industry and public relations industry affect this as the number one industries. So we just slowed down in the pandemic, but we are using this time to make our solution much better, and we are just doing our research for these markets, and I hope when we go through these days, we will be much ready and much stronger for the competition in the new markets. It will be a good thing for us, but for our current solution or current markets, we are just getting more and more traction from companies. Like, we are operating in Turkey, Netherlands, United States, and South Africa, but we have also distributions to Middle East and North Africa region and Central Asia countries, the Turkish-speaking countries. So we are just companies are just recognize that they have to do something, and they have to reach other markets, because the economy in each country is collapsing, and they have to do something. So the marketing is the cheapest way of doing this. So especially the public relations. So they are starting to use our service much frequently, but entering the big markets, as I told, the European markets like UK, France, or Germany, it's much more risky. So we just slow down that operations a little bit. But I hope we will enter these markets in 2021.
Thank you very much, Aydın. So I can see that there's a challenge ahead of you right now, which will eventually turn into an opportunity. So that's good to hear for the media industry. Now, going back to healthcare, Sertaç, we touched a little upon the methods that the healthcare industry has took to operate effectively. And then you mentioned that healthcare has been behind the curve a little bit, and then is trying to catch up. I'm also wondering, what shortcomings of the healthcare industry, what other shortcomings have been exposed due to this pandemic? And do you foresee any healthcare startups emerging to address such issues, for example?
Mm-hmm. Yeah, I think there are systemic shortcomings. I wouldn't attribute to the industry only. Of course, industry plays a role, but then you think about what happened and how you could have actually responded to this pandemic more effectively. I think there are a few lessons learned that we should take seriously and kind of act on. One of them is you look at the critical equipments that were used in intensive care. Unfortunately, a portion of COVID patients obviously required mechanical ventilation. And you guys might remember from news articles there was shortage. There was concern that there wasn't enough ventilators in national stockpile, strategic stockpile, and this was shocking to everyone because it's such an essential equipment. How do we not have enough, right, for those situations, for the times of crisis? I think this was a good learning in the sense that in the post-pandemic world, I think we are going to be looking at still globally integrated but locally more sufficient supply chain. I think we are going to be smarter in terms of maintaining a safety level for the critical parts of critical equipments that are going to be essential in treatment of similar conditions. In addition to that, I think there's an opportunity for open architecture innovation in medical devices. This is a terminology that's more familiar, for software developers, and we have it in the software world, but we don't have it as much in the hardware world. In the crisis times, some of the, again, another example going from the ventilator, some of the major manufacturers of ventilator products, upon the recognition of the shortage, shared their design specifications. And many companies from outside the industry, like Airbus, Mercedes, Tesla, Dyson, 3D printers, like stepped in to fill the gap. It was amazing to watch because it's a cross-sector solidarity that's required for these special times. I think we could be more proactive about this. We could go and take it to the next step where we have better wartime contingency plans, which proactively outlines the role each one of those industry players are going to play in situations where there's a shortage with special equipment. As simple as that, right? We could predefine those, so we don't have to start from scratch every time. We know what to do at the time of crisis. The response time is critical. So I think in general these are some of the opportunities for growth for the industry in general. In addition to that, like I would like to highlight, as I said, like cross-sector innovation, collaboration is critical. We have seen companies like NVIDIA, the Bill and Melinda Gates Foundation become very effective in developing solutions to the crisis. I think we need to maybe do that a little bit more systematically moving forward, learn from this and build on this momentum. When it comes to startups, we have seen a number of startups, I'm not going to say take advantage, but they were effective in understanding the unmet needs, healthcare unmet needs that are getting exacerbated by the situation with COVID. And they aligned their positioning and solutions to solve for that specific problem. And it helped them help others and also raise their profile. So you will see there's a significant decline in our industry as well. Both Hakan and Aydın talked about revenues obviously down, investment numbers are down, but in specific niche areas, especially telehealth, telemedicine, remote monitoring, wearables, anything that's along the lines of how can we scale healthcare, make it less analog, more digital, and help healthcare providers, hospitals be more efficient and effective. Any solution provider or product vendor that solves a problem in this space is becoming more and more attractive. So I think they are using their agility to immediately repurpose their mission and solve for these specific problems. So yes, to your question, I think there's a specific role startups play, but it was also pleasantly surprising to see large companies, like Johnson & Johnson as well, like to immediately, take this mission to heart and develop solutions. Like we have done things which we never did to be part of the solution, like the ventilator PPE examples I have provided.
Thank you very much, Sertaç. It's great to hear that there has been a cross-sector solidarity and people are now looking for scalable solutions, because I guess that's what we need going forward anyways. So going back to the hospitality, Hakan, do you foresee any new business models or tech startups emerging in the field? You slightly touched upon the hygiene being a new metric. Do you see anything around that that'll invigorate the entrepreneurs around this?
Yeah, absolutely. I actually want to touch base on the healthcare. I personally used Teladoc through my insurance last year. This was like maybe January and February before COVID hit, and it was the most efficient way of handling your situation without going to a hospital. You basically talk to a doctor, and obviously, if it's something serious, you have to go in. But if it's just a flu or poisoning or any minor issue, they prescribed antibiotics through the phone based on all the symptoms that you have, and it's directly sent. Your medication is directly sent. You don't basically have to move your fingers to do anything. You know, it's just an absolutely phenomenal experience. You know, I mentioned this because it's amazing how technology is improving our efficiency in all our in all our lives, personal and professional, and absolutely is the case with hospitality industry too. Everything is going touchless. People are now are scared to interact face to face. So I think the ultimate goal is here to really minimize the touch points, minimize anything that is touchable in the rooms, in the public spaces. Like, for example, we're moving away magazines and newspapers, and anything that is probably touched by another person is being removed. We're learning how to live a minimal life. We're going back to basics without the frills. So, which is, to me, it's very exciting. I like to live my life minimal. I think we all learned that over the last 6-7 months. But as I was saying, everything is going touchless. People want to operate everything from their smartphones. So there are apps that have been emerged that were already in the works, but I think through this pandemic, they accelerated the launch of these apps. Basically, what you can do with them is anything in the hotel. You can have a live chat, you can do concierge services, you can call your car from the valet, you can use your phone as a TV remote controller, you can set up your wake-up call from your phone. So the goal is really to minimize the touch points while not taking away the experience of being at a luxury property. Usually you see these apps being executed at the luxury properties. That's why I have been specifically, I'm giving that example. Robots for housekeeping is not far away. It's being tested as we speak. So you're gonna have machines doing all the housekeeping works and cleaning the rooms and possibly changing your sheets and towels and linens. So artificial intelligence becomes a very important tool. We're collecting a lot of data in the hotels, and a lot of the other brands are doing the same thing. We're doing this so that we can do personalized communications to our consumers. Someone who never goes to a bar, who never drinks, should not get a happy hour message, right? So we're trying to collect this data and communicate this to our consumers. And of course, not to mention very heightened hygiene standards. It all becomes a big part of this. So hotels that are able to do these things and cater to these consumers will I think win the brand loyalty as we embrace the new normal and for the long term.
Thank you very much, Hakan. It's really interesting to hear that the touch point is a very significant factor in getting back to adapting to normal. And so going finally to the media industry again. And after that, I'll switch over to the Q&A questions. Aydın, two of the most talked about damages in general to media has been production delays and suspended events. I know it's a little more general than the field you're working in, but on top of that, the consumers are also consuming more content than ever before. So given these realities, how do you see the future coming out?
Okay, yes, you're right. And as I mentioned before, the employment numbers are getting down in the media industry, and they have a competitor in terms of revenue, the social media influencers, because companies are spending their marketing budget more and more on social media, and influencers are getting higher portions in this market. But in the media, the companies themselves are trying to be big players in the social media as a player. And also, I think in time, in media, the free journalism will be much popular, and because everybody used to work from home, and you don't need to go to office mostly, and that means you can start for more than one company as a journalist. You can start more than one publication. You can write your article or create your content and sell it to one media company, and you can create another content and sell it to another media company. So according to me, free or independent media persons will, the numbers of the independent journals will grow in time. And only this can make the media much stronger, because you cannot create unique content with small teams. You have to reach the real content or the valuable journalists. And if your revenues are decreased, you cannot pay the quality journalists as a full for their time. And for the PR industry, I'm much involved in the PR industry, and I see that especially the big PR or marketing groups are consolidating their costs, and they are just starting to rent bigger offices, but much smaller than the office they used to stay in before the pandemic. So the employees will come 1 or 2 days to the office, and I see that they are just consolidating the workforce. So they can use a creative writer for 3 different companies in the group. And this will take also a new type of working in the PR industry. And until pandemic, COVID-19, freelancers were working with PR agencies or public relations companies, but it was not a very common thing. But after the pandemic, PR agencies are getting used to work with freelancers. They hire a freelancer for 2 days a week or 5 days a month, and it's enough for them. So the PR industry also is getting used to work with freelancers, and I think this will give the power, or this will make the PR industry much stronger. I think we have a short time, so let me finish that.
Yeah, thank you very much, Aydın. It's interesting to hear that the PR agencies are now learning to work with the freelancers, which has not been a practice in the past. Seems like a good opportunity again. So let's switch over to the questions we receive. And for all of our attendees, this is the time to write your questions down if you have any. We have about 10 minutes left. The first one I have here is, what does Sertaç think about a shot versus medicine for COVID? It's a very specific question.
Yeah, I mean, it's essentially, like a lot of companies are working on it. I think the question is focused on, the vaccine development, and including my company, several companies have initiated clinical trials, and Johnson & Johnson, I think, is doing it in US, Brazil, South Africa. We have resumed the clinical trials, and now it is initiated again after investigation of one unexpected case. The focus is really around developing a safe and effective solution. So there's a commission that oversees the trials and practices of these different companies who are essentially in the effort of developing the vaccines. I know that it's a tremendous priority, obviously, and we have, as a company, invested over $1 billion and pursuing this as a non-profit objective. So yeah, we are extremely optimistic. I think we have the foundation, the expertise, and have developed the solutions in the past that could become a foundation to develop a effective, safe, and effective vaccine for COVID-19. So hopefully, I think we should get positive updates early next year, Q1, Q2. That's my hope.
Thank you very much, Sertaç. Looks like we don't have any more questions today, and we have about 5 minutes left. Can you hear me right now?
Yes, we hear you.
Yes.
Okay, perfect. My connection stopped, everyone froze. So we have about 5 minutes left. I want to take this opportunity to thank the TUSIAD team, Aydın Woods and Barış Bey in DC, and Ayşegül Yıldeniz, the president of our organization, and İpek Tunca, Hayal Koç, and Neslihan Ülkemen from the corporate team for setting this up together. It's been a pleasure having you all on the panel. I got cut off again.
No, we hear you. We hear you, Buğrahan. Thank you. Thank you again.
Okay.
Thank you for the entire team and yourself to put this all together and bring us together and sharing our thoughts. It was very informative for us as well.
Thank you very much. And thank you, Aydın and Sertaç.